In early stage CLL, so Binet stage A disease or RI stage 0 or 1, the standard of care is watch and wait, because with chemoimmunotherapy or other approaches, there has not been an overall survival benefit shown in randomized comparisons. Now, the CLL12 trial of the German CLL study group tested in these early stage CLL patients after risk stratification early treatment with Ibrutinib and compared this in a double-blind fashion to placebo. Now, overall, the trial showed that with Ibrutinib in this early initiation, you could achieve prolongation of event-free survival, but overall survival was unchanged as compared to placebo. Therefore, for the trial as a whole, watch and wait will remain the standard of care. Now, what we did in this analysis is that based on central genetic testing in our central biobank, we investigated if particular genetic markers were associated with a particular treatment benefit from that early Ibrutinib. Now, prognostic markers that are well established in CLL are the 17p deletion, TP53 mutation, and unmutated IGHV status. And we tested those in addition to a range of other gene mutations such as SF3B1, Notch1, and others for their prognostic and potential predictive impact in the context of this trial. Now, what we found was that patients with unmutated IGHV benefited particularly from early Ibrutinib with regard to event-free survival. In contrast, patients with a 17p deletion and or TP53 mutation did not derive particular benefit from that early treatment, which is truly surprising. However, again, with regard to overall survival, we could not identify a subgroup that derived particular benefit from this early treatment with Ibrutinib. Also, among patients with unmutated IGHV, for instance, where we showed that particular event-free survival benefit, there was no overall survival superiority of early Ibrutinib as compared to placebo treatment. Therefore, for all genetic subgroups, the standard of care based on this analysis remains watch and wait, and early Ibrutinib initiation is not indicated for any of those subgroups. It remains to be seen if other novel treatment developments with next-generation BTK inhibitors, BCL2 inhibitors, or combined treatment in early stage patients could bring benefit with regard to overall survival for these patients, but this is obviously a research question, and outside clinical trials, watch and wait remains the standard of care for early stage CLL.